Working beyond 65? Huge Medicare mistakes you must avoid at all cost. Before we dive in, if advertisements should interrupt this video, please do not click off of the advertisements. Please allow them to play through as a thank you to me for bringing you this honest, valuable information for free. Now let's continue. The high-stakes Medicare decision. We're diving into a topic that affects so many of us, or will affect us at some point. Navigating Medicare, especially when your career trajectory extends beyond that traditional retirement age of 65. The title of our session, Working Beyond 65? Huge Medicare Mistakes You Must Avoid, really underscores the critical nature of what we're about to discuss. This isn't just a casual chat. This is about safeguarding your financial future and ensuring your healthcare coverage is precisely what you need without any costly missteps. Now, you might be thinking, Medicare? Isn't that for retirees? And traditionally, yes, that's often been the perception. However, the modern workforce is evolving rapidly. More and more professionals are choosing to work past 65, whether it's out of passion, financial necessity, or simply because their skills are in high demand. And that's fantastic. But it introduces a layer of complexity when it comes to Medicare enrollment and coordination with existing employer-sponsored health insurance. This is where a lot of confusion, and frankly, a lot of very expensive mistakes tend to occur. We're going to demystify this entire process for you. The cost of missteps, late enrollment penalties. Let's start by framing why this is so important. When you're working past 65, you're often faced with a critical decision. Do I enroll in Medicare now, or do I stick with my employer's group health plan? And if I do enroll, how do these two systems interact? Making the wrong call here can lead to significant penalties, gaps in coverage, and unexpected out-of-pocket expenses that can truly impact your financial planning for retirement. We're talking about situations where you could face lifelong late enrollment penalties for Medicare Part B, or even a lapse in crucial prescription drug coverage under Part D. These aren't minor inconveniences. They can represent thousands of dollars over your lifetime. So, let's break down the foundational elements first. When you turn 65, your initial enrollment period, or IEP, for Medicare begins. This is a 7-month window. 3 months before your 65th birthday, the month of your birthday, and 3 months after. During this time, you're generally eligible to enroll in Medicare Part A and Part B. For most people, Part A, which covers hospital insurance, is premium-free because you or your spouse paid Medicare taxes for at least 10 years. Part B, however, which covers medical insurance for doctor visits, outpatient care, and preventive services, typically comes with a monthly premium. This is often where the first major decision point arises for those still working. Mistake number 1. Ignoring the 20-employee rule. One of the biggest misconceptions is that if you're still working and have employer-sponsored health coverage, you automatically defer Medicare enrollment without consequence. This is often true for Part A if your employer coverage is creditable, but not always for Part B. The rule of thumb here, and this is a critical takeaway, hinges on the size of your employer. If you work for an employer with 20 or more employees, your employer group health plan is usually considered your primary insurance, and Medicare would be secondary. In this scenario, you might be able to delay Part B enrollment without penalty, as long as your employer coverage is creditable. We'll dig into what creditable means in a moment. However, if your employer has fewer than 20 employees, Medicare actually becomes your primary insurer when you turn 65. If you fail to enroll in Part B during your initial enrollment period in this situation, you could be hit with those late enrollment penalties once you do decide to sign up. This is a crucial distinction that many people miss, leading directly to those very avoidable mistakes we're here to talk about. The late enrollment penalty for Part B is a 10% increase in your premium for every 12-month period you were eligible but didn't enroll, and it lasts for as long as you have Part B. Imagine paying an extra 10%, 20%, or even 30% on your Part B premium for the rest of your life simply because you weren't aware of this rule. Mistake number 2. Not verifying creditable drug coverage, Part D. Now let's talk about creditable coverage. This term is absolutely essential, particularly when it comes to prescription drug coverage, or Medicare Part D. If your employer's health plan includes prescription drug coverage, your employer should provide you with a notice indicating whether that coverage is creditable. This means it's expected to pay, on average, at least as much as Medicare's standard prescription drug coverage. If your employer coverage is creditable, you can typically delay enrolling in Medicare Part D without penalty. However, if it's not creditable, or if you simply don't have prescription drug coverage through your employer, then delaying Part D enrollment past your initial enrollment period can lead to permanent late enrollment penalties for Part D as well. These penalties are calculated differently, but can still add up significantly over time. Always verify the creditable status of your employer's drug coverage. The smart strategy: leveraging the special enrollment period, SB. So, you've decided to continue working and you have employer coverage. What's the optimal strategy? Generally, if you're working for a large employer, 20 or more employees, and your employer plan is robust and affordable, you might decide to delay Part B and Part D. You'd then enroll during a special enrollment period, or SP, which is triggered when your employer coverage ends or your employment ends. This SEP typically lasts for 8 months after your employer coverage or employment terminates, whichever happens first, allowing you to sign up for Part B and Part D without incurring late penalties. This is a huge benefit, and understanding how to leverage the special enrollment period is key to avoiding those penalties. Mistake number 3. Confusing COBRA with active coverage. But here's another common pitfall: COBRA. If you leave your job and elect COBRA coverage, COBRA is not considered active employer coverage for Medicare purposes. This means your special enrollment period for Medicare Part B and Part D usually starts when your active employer coverage ends, not when your COBRA coverage ends. Relying on COBRA for too long without enrolling in Medicare can leave you with gaps in coverage or, again, those dreaded late enrollment penalties. It's a subtle but critically important distinction. Mistake number 4. Jeopardizing your HSA contributions. Another major mistake people make involves health savings accounts, or HSAs. HSAs are fantastic tax-advantaged savings vehicles for healthcare expenses. However, once you enroll in any part of Medicare, you can no longer contribute to an HSA. This is a big one for high-income earners and those maximizing their tax-advantaged savings. If you continue working past 65 and want to keep contributing to your HSA, you generally need to avoid enrolling in any part of Medicare including premium-free Part A. This requires careful coordination, as Social Security Administration often automatically enrolls individuals in Part A at 65 if they're receiving Social Security benefits. If you're planning to maximize your HSA contributions, you might need to actively decline Part A enrollment, which has its own set of considerations. This is a prime example of where personalized advice is invaluable. Strategy: Medicare Advantage versus Medigap, Part C versus Supplement. Let's also touch upon Medicare Advantage plans, also known as Part C, and Medicare Supplement plans, or Medigap. If you decide to go with Medicare, understanding these options is crucial. Medicare Advantage plans are offered by private companies approved by Medicare and cover all Part A and Part B benefits, often with additional perks like vision or dental. Medigap plans, on the other hand, work alongside Original Medicare, Parts A and B, to help cover out-of-pocket costs like deductibles and co-payments. The decision between Original Medicare with a Medigap plan and a Medicare Advantage plan is a highly personal one, based on your healthcare needs, budget, and preferences. It's not uncommon for people to choose Original Medicare and a Medigap policy if they value choice of doctors and predictability of costs, especially if they travel frequently. Medicare Advantage plans often come with lower monthly premiums, but may have network restrictions and higher out-of-pocket maximums. Mistake number 5. Failing to understand coordination of benefits. Now, let's circle back to the overall strategy. The goal here is to make informed decisions that align with your financial goals and health needs, especially when working beyond 65. Don't assume anything. Don't rely on advice from friends or colleagues who might have different circumstances. Always verify information directly with Medicare, your employer's HR department, and ideally, a qualified and independent Medicare advisor. These advisors can help you navigate the complexities of creditable coverage, special enrollment periods, and the interaction between your employer plan and Medicare. A crucial point that often gets overlooked is coordination of benefits. When you have both employer coverage and Medicare, it's essential to understand which plan pays first. This is known as the coordination of benefits rules. As we mentioned, for employers with 20 or more employees, your employer plan typically pays first, and Medicare pays second. For smaller employers, Medicare usually pays first. Understanding this hierarchy can help you anticipate your out-of-pocket costs and ensure claims are processed correctly. A misstep here can lead to denied claims and a lot of administrative headaches. In conclusion, let me say this: proactive planning is your defense. Finally, let's talk about the importance of planning ahead. Don't wait until your 65th birthday is just around the corner to start thinking about Medicare. Begin researching your options months in advance. Talk to your HR department about your employer's health benefits and their interaction with Medicare. Get that creditable coverage notice in writing for your prescription drug plan. Understand your Social Security benefits and how enrolling in them might automatically enroll you in Part A. Every individual situation is unique, and a proactive approach is your best defense against making those huge, costly Medicare mistakes. By understanding the nuances of Part A, Part B, Part D, creditable coverage, special enrollment periods, and the implications for HSAs, you can confidently navigate the Medicare landscape while continuing your career past 65. The key is knowledge, verification, and proactive planning. Don't let these complex rules lead to unnecessary financial burdens. Empower yourself with the right information and ensure your healthcare coverage truly supports your journey, wherever your professional path may lead. Thanks for watching. Subscribe so as not to miss our next value-packed video. Click the thumbs up button to give us a like for bringing you this vital free information. Comment below with a healthcare, Medicare, or long-term care tip that could benefit our friends.